the Maputo Protocol and what it is all about. Now, the Maputo Protocol is the protocol to the African Charter on human rights and people's rights of women in Africa, specifically women in Africa, very important to note. It is also an African regional treaty that is affirming women's reproductive autonomy as a human right. When was it adopted? 11th July 2003. And as I said, it is from Maputo, of course, in Mozambique. Now, the entry into force for this particular protocol was the 25th of November 2005. So let's just go on and look at some of the rights that women have when it comes to the Maputo Protocol. 1. Harmful traditional practices, e.g. child marriage, female genital mutilation, something that we've seen really has been facing a lot of women and girls in the continent. Next, reproductive health and right, of course, that's what we'll be talking about here. Next, we have roles in political processes, economic empowerment, and ending violence against women. Of course, very important in the global world, of course. Now, moving on now, let's just focus now on the Article 14, which specifically talks about health and reproductive rights. Now, it says that state parties shall ensure that the right to health of women, and that includes sexual and reproductive health, is respected and promoted. So what does this include? Of course, 1, the right to control their fertility. Number 2, the right to decide whether to have children, the number of children, and the spacing of children. Of course, that's very important, especially in the African setting. Not so many people in the traditional setting agree to this, but it is part of the Maputo Protocol. C, the right to choose any method of contraception. Now, moving on, another right that women, of course, have is the right to self-protection and to be protected against sexually transmitted infections, status, and on the health status of one's partner. Of course, this is in accordance with the internationally recognized standards and the best practices that are out there. Now, finally, when it comes to the health and reproductive rights, there you have the right to have family planning, education, awareness, very, very key. Moving on now to what state parties shall do to make sure that appropriate measures are in place. 1, provide adequate, affordable, and accessible health services, including information, education, and communication programs to women, especially those in rural areas, for them to know, of course, what are their rights. Moving on now, the state parties also should take this particular measure, establish and strengthen existing prenatal, delivery, and postnatal health and nutritional services for women during pregnancy and while they are breastfeeding. Moving on now, another measure that is to protect the reproductive rights of women by authorizing medical abortion in cases of sexual assault, rape, incest, and where the continued pregnancy endangers the mental and physical health of the mother or the life of the mother of the fetus. Of course, that's very important, and that's the conversation that we're going to be having here in studio. Like I had initially said, we'll be talking to Achieng Akumu. She is the Regional Director for Planned Parenthood Global. Right, let's just get into that conversation. And like I had said initially, I am joined by Achieng Akumu. She's the Regional Director, Planned Parenthood Global. Thank you so much for making time.
Good afternoon. Thank you for hosting me. Appreciate
right,
it.
Let's just start into first things first. What does Planned Parenthood Global do?
Planned Parenthood Global, let me start off because there's a lot of confusion with IPPF. But Planned Parenthood Global is the international arm of Planned Parenthood Federation of America. We have programs in Latin America as well as in Africa. In Africa, our programs are under the framework, and you did a brilliant job of outlining the Maputo Protocol, right. Article 14, Section 2C specifically, as well as states' constitutions and relevant policies. We work through trust-based partnerships, okay? So we are the technical advisors, we do provide the funding, but through a rigorous assessment process, we find partners that have the need to implement key aspects of what you laid out in the Maputo Protocol, or even in their state constitutions where commitments have been made to reproductive health rights. So it could be comprehensive sex education, it could be messaging, you know, for social cultural levels, you know, in communities, etc. So we provide technical support to partners we work in 5 countries right now. We touch 15. We're in Burkina Faso, Senegal, Benin, Kenya, and Uganda. We're headquartered in Kenya, but we touch 15 other countries because we have worked and had programs in Ethiopia, Nigeria, Zambia, to name a few, and that work has continued under, you know, different Planned Parenthood clinics in those countries. But we do not provide services. Ours is advocacy, you know, with regards to information, with regards to policy, you know, to implement, and then also the youth engagement, which I'm here primarily to talk about today, as well as we used to do quite a bit in terms of service delivery, which we've switched now so that we're training our service advocates, right? Service delivery people to be more advocates.
Very interesting. Seems very 360 to it. But I want us to now just start talking about the state of youth sexual and reproductive movement in Africa, ever since, of course, the Maputo Protocol that I was talking about. What do you think is the state of the youth sexual and reproductive movement in Africa at the moment?
It's urgent. It's critical. That's why our movement that we're growing, we're building, is called Billy Now, to address the needs of young people now. Not later, but now. So it's urgent. It's a priority. You need healthy people to grow your economy, correct? And I think that's really important, you know, with the number of high school dropouts, the increased poverty, mental health issues, etc. You know, the Maputo Protocol is truly one of the most progressive, right, instruments globally, not just for Africa, to address all rights, women's rights in particular, but then you also extend it not just to the marginalized, of course, populations, but to young people, young women in particular. So the state of in Africa there's progress has been made, as we know. However, there's need for much more. There's much more work to be done, given the heightened numbers with regards to teen pregnancies, unintended pregnancies, defilement, FGM, child marriages. You know, all those issues are still in a state of play, unfortunately, in the countries. I think the improvements, the statistics should bear that they have been minimal, rather than, you know, by leaps and bounds.
But what do you think is the factor, of course, or what factors influence, you know, the rate of the sexual and reproductive health of youth going to the level that it is right now?
You know, information is very key. Okay, you know, young people in any walk of life, in order to succeed, you need information, you know, education, etc. So that's a key part that's missing. Sex education is not taught in schools, right? Because we are about young people planning, right? Protecting themselves to prevent harmful practices or unintended pregnancies, and then plan for their futures. You can't do that if you're not armed with the information or the services, etc. So the lack of access, okay, to information and services is very key. There's a lot of misinformation out there, and so that's one of the goals that we really work hard using, of course, what young people use. So if it's technology, TikTok, Facebook, whatever, those are the platforms that we support to disseminate accurate information, and then also the social cultural norms. You can't help, you know, in Africa, we are deep rooted in culture, and so changing behavior, you know, those norms requires a lot of conversations, communication, what we call intergenerational dialogues, etc. And then that's really key, and that's part of the work that we support, especially for young people to be respected, right? They have their goals, their aspirations, and so how are they equipped so that they can speak to their chiefs at the community level, parents, school teachers, as well as policymakers, so that they can advance, right? Because we want a healthy generation, yes?
Right, you know, definitely from an African traditional perspective, it's a bit difficult for young people to talk about it.
Yes.
But let's now move on and talk about challenges.
Yes.
What challenges do you think government in Africa are grappling with when it comes to addressing different backgrounds face to face when it comes to providing comprehensive sexual and reproductive health services?
We've talked about the social cultural norms. Values on the continent, you know, are really key and important. And if you want to change, to allow for young people to express themselves, etc., that's a huge challenge. So in many countries, especially in Senegal and Burkina Faso, Muslim majority countries, that is the primary focus, you know, before we engage with the policymakers. Look, the greatest challenge is the siloing of SRHR. Okay, it's been siloed. It's not underscored as a development issue, right? So that the thread is needled across all sectors, right? You need a healthy population in order to grow the economy. Right. You need in other parts of the continent. You know, you want to discourage young people from jihadism. You want to discourage them from criminal enterprise, etc. So how is that done? The intersectionality arguments need to be made stronger. Okay, SRHR is not just a health issue. It weaves across all aspects of governance, and it needs to be seen that way. When, you know, tons of money is being put into conflict prevention, yes, there also needs to be put into health. Exactly. Yeah. COVID was an eye-opener for us, right? To see what was not available, let alone for the general population. But then when you talk about access to contraceptives and information so that young people can protect themselves, the funding is not there. That commitment, right, it's not been made with regards to you know, access to services and accurate information.
Why do you think it's not prioritized, though? It's very important, of course.
Well, that's a political question for another day, okay?
Sure.
But you know, you know, the instruments are there, the documents are there, the commitments have been made. Yeah. Okay, so I think what I know is the accountability mechanisms need to be strengthened, right? So that governments are held accountable to these commitments made, not just at international, regional, national, but also local levels. That's really key and very important. And for them to also understand, right, again, that intersectionality. You don't address this issue here. You've got these young people on welfare, right, unemployed, right? Unemployment is rising, and that's the cause of migration. I've worked many parts of the world, and the largest migrant population I've seen are African, young boys and women with babies. So these are the economic arguments that need to be made as to why you attend to the needs of young people, their health rights, and then they can contribute. They'll stay in the country, help grow the economy, as well as be honorable citizens, as opposed to the other options that seem more attractive when now they're dropouts and the sense of hopelessness, right? Because there's also, as we know, the numbers have increased with regards to teen suicides, etc.
Sure,
so it's all linked, right? It's not just about young people having careless sex, right? This is about how do we help them to plan, protect themselves, prevent the harmful practices or behaviors, and then plan for their future.
Interesting. Earlier on, you talked about Billy Now.
Yes.
Very interesting.
Yes.
It is a campaign, I do know that.
Oh, wonderful.
But tell us more about it. What is it about? What is it seeking to achieve?
Billy Now actually grew out of the Sahara Desert in a country called Burkina Faso, and it's about 1 billion young people in charge of their bodies, their culture, and their destinies. The Maputo Protocol documents, when you read the policy documents that came out of the African Union at that time, this is not a new issue, that young people have their needs and their aspirations, but yet they don't have voice. So this initiative is about allowing young people to amplify their concerns, their needs, in a constructive manner, educating, training, as well as to engage all manner of leadership in a constructive manner so that they can exercise their rights. They need to know their rights in order to exercise their rights. And so that's what Billy Now is. And again, we're not targeting necessarily the elites in the capital cities. Where we've worked in all these countries I've mentioned have been with the marginalized populations outside the capital cities. And again, using what young people determine is their means of communication. So it's technology. There's a technology base where young people can have Q&A responded to by professionals. There's safe spaces where concerns and issues can be raised, as well as access to information and youth-friendly service providers. That's really key. So it's a campaign. We say 1 billion. Look at the population already, you know, on the continent, youth 1.8 billion.
Very big.
And the idea is that it's globally connected, right? Locally led, but globally connected, because, you know, youth across the globe are facing the same challenges, SRH challenges. And I think it's really, we believe that, you know, this movement, it's not necessarily 1 billion young people. It could be $1 billion in resources. It could be about opportunities, 1 billion opportunities to lift young people out of a sense of hopelessness, poverty, and empower them so that they can enjoy their life.
Right. Talking about opportunities, let's just link it up with, of course, some of the initiatives that are there, of course, to make sure that the campaign you're talking about succeeds.
Yes.
Are there any particular organizations that you're working with to bring out such great ideas?
We do. We do not implement. We work through trust-based partnerships. So in many countries, we work with human rights organizations that litigate, right, strategic litigation, to get the judiciary or the government to pronounce itself on particular commitments that have been made. We do work, we did in the past work under the Closing the Gap program with service providers. Again, training providers to be, you know, more sensitive to youth concerns, as well as, like, you know, providing the access that's needed without the stigma, okay? You know, getting rid of the stigma is really... So our partners vary across the continent. We also have communications, because messaging is very important. The thing I'm missing, I quote myself, is that our initiative is youth-led. We are just the technical advisors. The youth co-create these initiatives based on the needs of their community and their countries. So the co-creation is there. They drive it, implement it, etc. We, our partners, basically are technical advisors. And so we're very excited, you know, where even the budgeting is done by young people for this initiative.
Right. Yes. I like the initiative itself. Sounds very, you know, it has a good direction. But I want to know now, practically, are there any success stories when it comes to this particular campaign? Yes,
in Burkina Faso, the policy wins have been significant. The language with regards to youth's access the young people have a seat at the table. Okay, not just Ministry of Youth, Sports, etc., but in terms of policy with regards to their needs and additional information, be it FGM and HIV/AIDS, etc. The young people have been invited and are at the table. One of our colleagues just had a workshop last week with that was on the new, what they call an image box. I guess it's something to train, right? With the new sex education program in Burkina Faso, they've created a pamphlet to train. The Director of Health led that workshop. So that's the kind of partnership. In Senegal, there again, it's working the policymakers, you know, working the various committees in the parliament that are committed and seeking to advance implementation of the Maputo Protocol and all its and all the key items in there. Let me see. And in Uganda, the same with regards to moving legislation that has, you know, sat. Our partners have been very successful in terms of moving legislation with regards to comprehensive sex education. It's not been signed into law. However, it's moved off the shelf. The discussions have been held, you know, through vigorous communications campaigns to educate the public, again, on the importance of youth needs and youth access, you know, for a healthy society.
I want us to come back here in Kenya now.
Yes.
How do you ensure that the movement, strategies and interventions consider the needs and, you know, experiences of young people in the country?
We talk to young people. You have to listen to young people. That's the number one thing. That's the priority. We do not come with our agenda, okay? You know, so we in all of our programs, our youth officers and managers are young people themselves. So they can connect and they can relate. We have worked in Kenya through other programs, Closing the Gap. We've stood up Youth Peer Provider Program, as well as other advocacy-led activities. And so the precedent is there. Okay, so it's not like rebuilding or starting from the ground up. This is just a little bit more of a dynamic, disruptive, and disruptive in a positive sense, that you know, young people will take the lead and learn how to constructively, again, engage with policymakers, traditional leaders, and then also build that network. That's the whole point of the Billy Now. You're not in this alone.
Yeah.
You know, there are 1.8 billion young people, and we're looking to globally connect them, you know, through leverage our networks, you know, Planned Parenthood Global with Latin America and also the US and other places that are interested. So ensuring in Kenya, we've brought that, the lessons that we have learned from across the continent, you know, to Kenya. We work with partners that have been doing this, NILAB for the enterprise, you know, because what we know about young people is SRHR is not their priority. It's employment. Right, we know it's about what does their future look like. So it's making that connection. Again, I talked about the intersectionality earlier. So that's really important. So we have partners like NILAB that will help us with that, and then we've got other partners that definitely, you know, have been doing work with young people and can help us, again, in the marginalized and rural areas.
Finally, now I want us to now talk about the next steps for the movement.
Yes.
And what long-term goals does the movement have for improving youth and sexual reproductive health in Kenya?
Okay, this is a catalyst for discussions, and I thank you for this opportunity, because it's important that, you know, this language and what the work that we are doing, organizations such as Planned Parenthood Global, is mainstreamed. It should not just be like on whatever National Health Day or International Youth Day, etc., but it is part of normal discourse, right? And understanding that young people, in order to have a transformative democracy, young people need to be included.
Inclusivity is important.
Inclusivity is key. Thank you for that.
Right.
And so that is really key. Okay, so again, equipping young people. So next steps, equipping the young people, okay, with the skills so that they can engage constructively. Okay, the information, accurate information, not the misinformation that's out there, so that they can protect and prevent harmful things from happening to themselves. And then also the advocacy skills, so that their voice, they can amplify their concerns and get themselves a seat at the table with the policy, traditional chiefs, or whomever is making the decision about their future. They are able to have that discourse. Yes.
Get their seat on the table, very important point there.
Yes.
Thank you so much for your time. That is Aching Akumu. She's the Regional Director for PP Global, that is Planned Parenthood Global. Very interesting conversation. Thank you.
Thank you.